Okay. Well, so how does water benefit our kidneys and bladder then, too, then?
Water, proper amount of water helps prevent the formation of kidney stones. So when a person is dehydrated, they're much more apt to make stones in the kidneys. And anybody who has ever had a kidney stone knows that kidney stones are extremely painful. I've been told much more painful than childbirth. So plenty of water helps us prevent making kidney stones. It also helps to keep the whole urinary tract clean and prevent urinary tract infection.
So is there a limit on how much water we should ever drink?
There is a limit. A person can drink too much water and they can get their electrolytes in their body out of balance. So we need to be careful about that as well. Some individuals with certain health concerns cannot have even the normal amount of water. So if a person has kidney disease, they're going to be instructed by their physician to have less water because the kidneys cannot handle the workload of removing all the water from the blood. Somebody who has cirrhosis of the liver will probably be instructed to have less water. Someone who has congestive heart failure, because the heart is just not able to do all the work necessary to get the water pumped back up out of the extremities and to the kidneys. So yes, there are health conditions where water needs to be limited, but in general, you know, the rule of thumb, half your body weight in ounces of water, or anywhere between 1.5 and 2 liters for women and 2 and 3 liters for men.
Well, if you actually think about that when you drink water, and if you just spread it out over a period of, if you're up for 14 hours out of the day, what does that break down? If you drink 96 ounces of water, or 100, over 14 hours, what is that, 6-7 ounces a day, or every hour, which isn't a whole lot, because a lot of people drink a soda or a cup of coffee, or they have something at their desk, or that they're doing to always supplement their water intake. And actually what they're doing is when they do that is they bring in the bad qualities of what they're bringing, the sugar, the caffeine that we don't need, which actually has the dehydrating effect on the body. Right. So what is this all, when you do all of this, what effect does it have on the joints of the body and the back and all these other issues if we're
when you do the...
well, when you're drinking water, I mean, if you're not getting enough water.
Dehydration. Dehydration has a major effect on the joints of the body. And your whole spine is a whole bunch of joints right in a row. A lot of people don't think of their back as joints, but it is. So if you have shoulder issues, knee issues, ankles, wrists, we think of those as our major joints. But between every vertebrae in your back, you have a joint. And as the body becomes dehydrated, the cartilage in every joint of your body starts to break down. And, it's not the first thing that we think of when we have joint problems. We think, oh, I'm getting old, or I'm getting arthritis. And it's just the first signal that the person is dehydrated and they are not giving their body the water it needs to rebuild those cartilage cells. And it's also extremely important in order to remove the acid that's produced in the joint from friction. So joints are supposed to be alkaline, like bathed in the synovial fluid, which should be an alkaline solution. And as the joints wear, you get acids in the joint, and if you're properly hydrated, then that's being carried away back to the bloodstream to keep that environment alkaline. But when we become dehydrated, it becomes acidic, and that actually those acids in the joint are what get the nervous system to send a signal to your brain that says, ow, this doesn't feel good. So instead of going and getting an ibuprofen out of the cupboard, you should go get a glass of water. That's what your body's telling you. But people are very undereducated about that. No one's informing them that these joint issues often begin as just dehydration.
So how do you, what do you do for a customer, an individual that you treat that comes in and says they don't like water? What do you do in that situation?
I educate them about the importance of water for their bodies, and it's really about knowing what water does in your body. So the majority of people, like I said, are very undereducated about the need for water in their body. And once you explain this to them and help them learn, so I don't tell them what to do. I educate them. I send them home with information so they can learn about how water or the lack of water is causing or affecting the condition that's going on in their body.
And what role then how does salt play a role with water in our body?
Salt is extremely important for having the proper water balance in your body. It's also important in getting those acids out of the joints. And from another standpoint, salt is it's a building block in the production of hydrochloric acid in your stomach, which you need to break down minerals in order to have strong bones so that your body doesn't try to build up your joints for strength. So that's also a really roundabout, backwards way of another addition to arthritis by having improper hydration and water balance in your body.
Well, I mean, a quick question about salt. I mean, what is it? I mean, there's different types of salt, correct? I mean, there's good and bad salt. What is a good salt that you should maybe incorporate a little bit into your diet along with your proper water hydration to keep your joints well?
We're going to get to it in 10 tips for healthy living today, but the best kind of salt is sea salt that hasn't been refined. So a lot of people, when they come into my office, they say, well, I'm using sea salt, because a lot of people who come for this type of medicine, they have some information and background in nutritional well-being, and so they're trying to eat more healthy. But usually what they're using is something that looks just like table salt. It's called sea salt, but it's nice and shiny white and pours just like table salt, and that is not a healthy salt. It's the same thing. You've refined all the healthy trace minerals out of it, and now you just have some substance similar to sodium chloride that isn't going to give you the health benefits that a whole sea salt that hasn't been processed will give you. So how do you know if it's a good salt? Well, you shouldn't be able to shake it really out of a shaker. You should have to pick it up with your fingers. It should be kind of damp, and you sprinkle it over your food. It's usually brown or gray in color. It might be pink. It'll have a name like Celtic sea salt, Himalayan sea salt. There's various brands available, but you talk to an educated health food store owner. They can help you find a good, healthy sea salt that's beneficial to your body. Well,
so I guess the next question I have, how does, people with back problems and things like this, how does this all relate to back issues and disc degeneration then?
Disc degeneration, again, begins with dehydration. Your discs are like hydraulic shock absorbers in between the vertebrae in your back. And so if you think about it, I don't know, half of your body weight is up here. Your spine supports all of that. So, you think about everything that's up here, all your organs, your ribs, any excess body fat that you're carrying around, and your upper limbs, your head, which is very heavy, all being supported by the vertebrae in your back, and each set of bones in there being supported by a disc that's mostly fluid. And as you move, it has to give, because otherwise you wouldn't be able to, squirm around and twist and turn.
Right.
So it's like a hydraulics. If you have a hydraulic chair, you can push down on it and it'll come back up. Mm-hmm. So that's how your discs are. They're fluid filled, and you twist and turn, and the water kind of squeezes around in there. Some squeezes out, and then you come back, and then that refills. So if you allow your discs to get dehydrated, you're going to lose that hydraulic type action, mm-hmm. and they are your protectors between your bones. So when you start getting severe disc dehydration, the flat surfaces of your vertebrae, they can rest and move on each other as support. But the facet joints, the kind of angled joints on the vertebrae, they have a cartilage cover again, so that's the joint part, and in between you have the disc. So if the discs start degenerating, bulging, slipping, now you're going to get pressure on the facet joints that aren't supposed to be weight bearing. They're only supposed to, you know, for this type of action, not for weight bearing.
Sure.
And then that's going to be extraordinarily painful for the person. So a lot of times people don't know they have back issues going on until they've already got disc degeneration well underway. And educating them about the part that water plays in back health and disc health, you know, I think that's number one. And, you know, I've had probably hundreds of patients who've said, how come nobody's ever told me that I need to drink water? You know, maybe because we're not supposed to have to tell you, maybe